So I always start with this world map, and my default view for this, like when I look at this world map, I don't automatically think all English speaking, all access to healthcare, all access to technology, right? Although, this is a world map, and I don't automatically think that, but this is the way a lot of technologies are designed. They're designed mostly primarily for someone who has access to healthcare, right, for clinical technology, somebody who has primarily English speaking, so like patient education systems are mostly in English. Things in, if you're using Epic and you use MyChart, you know some limitations about some of their translation for ABS and things like that. And also, when we talk about access to healthcare, we're talking about people who maybe socioeconomically cannot afford maybe some certain iPhones. Because remember, some applications require your iPhones to be this grade before you can have this app, right? Because it's just, updated. And you can buy iPhones or other kinds of smart devices from like Walmart for $100 or $70, but that doesn't work with the patient portal, right? Not all the time. So just kind of thinking of that in mind. And so let's look at the map in a different perspective, okay? So we designed this way, but let's look at it from a different perspective. So when you look at it, you don't see that there are many different cultures, there are different religions, different languages, and different lenses of the world based on their people who live in the map, based on the views from the area. So if you grew up in another country, if you have, a background that you maybe grew up in a different state, like for example, I grew up in Texas, it felt like a different country, but I live in California and work and live in California. So it's that kind of view to kind of think about it. And then think of different kinds of cultures that have, some cultures have something we call individualism. A lot of Western cultures do that. And there's other cultures that have something called collectivism. And so that might look different in healthcare. For example, somebody with a collectivist culture might regularly help pay for, services or food or healthcare for like a family member, and that doesn't feel wrong, right? In an individualistic culture, that is something people don't want to do. They want to help people thrive, and like just different points of view, and neither one is wrong. We're just saying like these exist, right? And so whether we practice individualism or collectivism, all of these things influence our healthcare beliefs. So when you go for a little further, excuse me, my fingers, they're waking up now. Okay. So when you think about it, if we take a closer view, so like we're seeing the world map, and then let's zoom in, let's take a macro view, but let's zoom in a little bit more. Let's look at the United States. It's kind of like the world map because we're very multicultural, right? We have many different religions here. We have many different racial, ethnic, multiple, lingual, everything, right? And we also are a nation that doesn't have full access to healthcare, right? And we have different rules, and we're going to talk about like all of that. But when we think about that, the way that we are here, the way that we're viewing the way that we're designing technology, are we currently designing for person-centric care? Just something to think about. So let's talk about that for a second. Why, when we look at this map and we're looking at the different cultures and stuff, so how does that affect how we design? So let's talk about social norms. So again, I grew up in Texas. I live in California. So I grew up with different potentially social norms than like maybe somebody in California did, like what a gender norm is, what is a male and a female's role in a family unit, what is, correct, is LGBT correct and all that. So those are those norms that people grow up with, and sometimes those will create what we call implicit or explicit biases. So we grow up with this set of beliefs, and then we go to work. And whatever you work at, so let's say you work in a bank, and you're someone who makes a decision on somebody to get a house loan, and part of that decision is subjective, right? So some of it's financial and the other part is subjective. So you're the final decision maker and you make a subjective decision, and then sometimes you make a decision based on your beliefs, whether you know them or not. So explicit and implicit bias, and I'm bringing this up because we're going to talk about how that gets into the healthcare system. So this is just kind of touching the iceberg of this. So explicit bias means you're consciously aware. These are openly expressed, potentially, discriminatory behaviors, treatments based on factors such as gender, race, ethnicity, religion, social characteristics. And these are, like I said, these are often influenced by personal beliefs, experience, and cultural conditioning. And cultural conditioning, by the way, can also include things like the media, television, all of those things are cultural conditioning, like what we see portrayed as what is a gender norm, for example. And I am using that a lot because I have an example that we're going to do together. Implicit bias, these are attitudes, stereotypes, and things that we hold unconsciously and unintentionally. So we might have actions about this, but we're not really aware until after they're done. And these are implicit biases are the things that we can always work on. Like we do self-reflection, we realize, oh, I have an implicit bias on how I think about gender, for example, like what gender role is. And so you can work on that, and it becomes a little bit more, you become more aware, and you can, work on that to be a little bit more fair and more intentional in your behavior. But it's important to note, like in healthcare, that either of these, whether it's implicit or explicit, they impact healthcare delivery, patient experience, and how we design a workflow. These biases can contribute negatively towards patient outcomes, the quality of care that we give, and healthcare disparities. So recognizing and addressing these biases is crucial to promoting equitable and person-centered care. And although it might be hard to admit that, hey, I might have some hidden biases, it's really hard to say that I have a hidden bias. But unless we are willing to take that deep dive, it will remain hidden, but it's still going to be impactful because they're still going to show up in behaviors and decisions, and it will impact people, coworkers, patients. So if you're in the room and you're making decisions about a vendor that's going to come into your organization, or if you're in the room and you're in a quality position and you're making decisions about what's going to change for patient quality, and you have some biases, you'll still get to make an impact. But if you are aware and you do this kind of work, you could make a positive impact. So let's talk about that. I don't want anyone to fret because there's lots of tools. So culture humility, let's talk a little bit about that. So culture humility principles, again, when I talked briefly in the beginning of this, I said that these were relationship-based. Absolutely, they're relationship-based. So these are principles of, let's go to the next slide. So these are the principles of recognizing and challenging power imbalances, right? Urging institutional accountability, these are the core principles of it, and lifelong learning. So when you look at the textbook definition, basically it's telling you that it's a relationship mindset, it's not a culture competence, or implies cultural competence. It's more about focusing and learning it's more about, recognizing and challenging cultural assumptions, biases, and power imbalances to build respectful and equitable relationships. So that really focuses on that. So culture humility acknowledges dynamics and the evolving nature of culture, and it promotes a lifetime commitment to learning and growth. And this is key because if you take away anything from this talk today, is if you can at least incorporate the lifelong learning and critical self-reflection, no matter what you do or where you go, this is a step up. Like, once I started to do this, I started to think back in my career in healthcare, and I started to have so much more empathy of situations that I didn't understand, my actions or other people's actions, And I started to do better things. I would say better things like working in DEI and trying to promote, more equity. And so I learned a lot from doing the self-reflection and lifelong learning. And I encourage everyone that if you are already on a DEI journey, just to continue, because it's never, you're never going to learn enough. Like I still don't know everything.